All right, it is time for a little surgery update. So it's been a while since the initial video went out, and a lot has happened since then. So I thought we'd talk a little bit about it and give you guys an idea of where we're going next. So when I left off, I had seen a surgeon and we had discussed the next steps. So the first step was to get dental clearance and to get a coronary angiogram. So dental clearance is on its way. They did find a fractured tooth that needs to be taken care of, so that will be taken care of in November. The coronary angiogram, for those that don't know what that is, basically what they do is they take a tube, stick it into your wrist, up through your arm, and into your heart, inject some dye into your heart to see if there are any blockages inside of the heart. They did find a significant blockage that needs to be taken care of. They could have put a stent in during that whole procedure, but it's actually better because the surgeon's going in anyway to just do a bypass and go ahead and take care of that. So along with the list of things the surgeon has to do, it's going to be an aortic valve replacement, aortic root, and now a bypass. So that's that. I don't know if I mentioned in the last video, but I was going to be potentially seeking a second opinion. Not that I didn't trust the surgeon that I saw, because I do. However, the cardiologist that I've been seeing for the last few years, not exactly a fan. And I went to a different cardiologist in a different hospital network and had a much, much better experience. So to give you an idea, the guy who did my coronary angiogram was my cardiologist. And I actually saw him 4 days after the procedure. He didn't know he did the procedure on me. He didn't know when the procedure was. And it was like he didn't know I had a VSD when I was born. Like, he did not have a clue what was going on. To give you kind of the opposite side of the spectrum, the new cardiologist that I saw, before I got there, I was actually on the road driving to him, and they called up and they're like, hey, he read your chart. He wants you to see a surgeon. There's really nothing for him to say. And I was like, listen, hey, like, I want to see this guy anyway, because I'm looking for a new cardiologist as it is. I just want to get a sense of him and that sort of thing. And they're like, all right, cool, come on in. So it was a much different experience. So yeah, I've moved over to a different cardiologist and a different surgeon because of that. So I met the new surgeon today, and we talked at length about what needs to get done. So the first thing that needs to get done, I mentioned already, is that bypass. So they're going to go in during the open heart surgery, grab an artery or vein here in the chest region to do that bypass to that one area that needs a bypass. So that's the first thing. The second thing is the aortic root has become enlarged. He is going to work on that as well. And then the final thing that he's going to do is an aortic valve replacement, potentially. So there are two things that happen with the aortic valve replacement. So mine's a little bit of a strange case, and we talked a lot about it because the imaging that he's seen isn't exactly clear on what's going on. So I think I've mentioned, I don't know if it was in the video or if people have asked me the question, whether I have a bicuspid aortic valve or a tricuspid aortic valve. The difference is 2 or 3 leaves. So I actually have, we think, a tricuspid valve, which is, I guess, considered normal, but a lot of people have a bicuspid. It's not really the end of the world either way. However, when they went in to do my initial surgery, one of the leaves on that tricuspid valve was elongated and it was getting in the way. So as a precaution, they tacked up part of that cusp so it wasn't in the way anymore. The problem when you do that is there's scar tissue and calcification that can form as a result of that, which they think has led to my aortic valve not moving the way it should. However, what they did when I was 4 lasted 40 years and was probably the right decision to do, because it probably could have caused other bigger issues. So it's not that they did anything wrong back then, but they had to fix that. And now we're dealing with the next part of the puzzle. So what he said was there is a chance he can go in there and clean up the aortic valve. If that's the case and he can do it, he will not need to replace the aortic valve. However, he said more than likely he's going to need to replace it, so we're going to go with a mechanical valve. So it's a mechanical valve, one bypass, and aortic root replacement or repair. I forget which. It's essentially the same thing. So, yeah, that's what's happening. We have a surgery date. December 8th is the surgery. So before then, I have some pre-op stuff that I have to get done in November. Plus, I have to get dental clearance. So I do have a tooth that needs to be extracted before all of this can happen. So that is happening in the beginning of November. And then we have dental clearance, and then we'll have the ability to go in for surgery. So that's where we're at. I think that's about it. I have spent a lot of time recording this because I realized that I was having some audio issues, and I think I fixed them. At least I hope I have. And yeah, I think that's it. So if you have questions, comments down below, text me, call me, email me, whatever works for you is fine. Just remember, I'm not really a phone person, so you might need to bribe me to get me on the phone. I accept cash and donuts. So yeah. That's it. Thanks for watching. See ya.